Hi, and welcome back to Dr. C's Morning Minute. So, a recent study out of the University of Manchester suggested that ADHD is often overdiagnosed in children with autism. I found this clearly to be the case because so many of the signs and symptoms of ADHD overlap with autism. Kiddos may seem preoccupied or not particularly in tune, or they may be getting out of their seat and going from one place to the next, and these symptoms look very much like ADHD. However, what we find so frequently is that the very symptoms and signs of autism would then look like ADHD. The child is getting out of their seat and going over to do whatever else they want to do, not necessarily because they have ADHD, just because they're not particularly in tune with the task at hand, with the expectation at hand, with the social appropriateness at hand, and they're just going to go over it because that's what I want to do. See that very, very commonly in children with autism. Again, not ADHD, but simply signs of autism. The last diagnostic manual, in fact, DSM-4, it was essentially a no-go to diagnose autism and ADHD because of that very factor. DSM-5 has loosened up a bit in that respect. Now, I bring this up to clarify that, but also to point out that considering any diagnosis, it is vitally important for me as a practitioner and you as a parent as well to think about there are certain signs and symptoms that are being considered for that diagnosis. However, oftentimes there's more than one explanation. You always want to go with if there's a better explanation or a simpler explanation for a certain condition, for a diagnosis. You always want to go with a simpler one, typically anyway, and the one that ultimately is decided by the team to be the better explanation. Kiddos may be off task and distracted because they have dyslexia, not because they have ADD. It's just the work is really hard. And so they're off task, they're looking around the classroom, and that may be picked up at times as the child's lazy or the child's ADD-ish, but no, that's not the case at all. The work is just really difficult for them, and they're putting forth so much effort that by the time, after a few hours, they're just, I've had enough of this, I need to take a break and look around the room and just chill for a while. Not because they have ADD, but because they have some reading issues or dyslexia. So, again, very important things to consider, very important things that I consider during the evaluation process. So, I hope that helped. See you next time, Dr. C's Morning Minute. Bye-bye now.